I know of people that did not get in, good students did not get in because of their interview. And the classic example, one of our best students, 33, MCAT. What's the average? 29 to 30. He gets into a friggin' argument with the interviewer during his interview. That's crazy. And he didn't get in. He applied again the next year. Didn't get in. He graduated from pharmacy school last May. Okay? He never did get in. And it was based on his interview. And I know of other people that it wasn't that extreme. On your interview, you know, there's certain qualities they look for in a physician. Somebody that says it's all me, 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 oh boy, that's bad. Okay? If you have any indication that you're going in there for the money, that's bad. Okay? I once had a student, and I could give you numerous examples of this. Why do you want to go to med school? Well, I hear the hours aren't too bad and the pay's pretty good. If he says that in an interview, he's dead meat. Okay? We'll give you a practice interview. Our pre-med committee will give you a practice interview. And don't do like this kid said this past fall on the interview. Fortunately, Dr. Barnes had to go to the bathroom, so he was down in the men's room when this kid said this. I said, why do you want to be a physician? This is the pre-med committee. He says, you know, I was watching Dr. House and I really like that. If Dr. Barnes would have been there, he'd have went up one side and down the other side. You ever watch House? What if I acted in microclint like Dr. House? And I say, you're a friggin' idiot. What rock did you crawl out under, okay? What are you going to do if I acted like that? You'd get up and leave. But somehow you admire him. Yes, it's entertaining, but you admire him. Your personal statement on your AMCAS application. You have to write a personal statement, 300 words. You know how long it should take you to write that? AMCAS, Dr. Barnes said they open in July, actually about June 1st. You ought to get on June 1st and start filling out your application. You ought to start writing that personal statement now. Rewrite it and rewrite it and rewrite it. You don't write it the night before and submit it. You don't write it the week before and submit it. You give it to people. Give it to your mom and dad. Give it to people you had in English. Give it to people in the pre-med committee. They'll read it. It's got to come from the heart. Frequently, kids will tell me on their personal essay, tell me what to write. If I have to tell you what to write, you're in the wrong profession. I can't tell you what to write, but when I read one that's good, I can tell you that's good. When I read one that's bad, I can recognize it's not being very good. When it comes from the heart. I know of people that did not get in because their personal essay was lousy. How about grammar mistakes on your personal essay? That is stupid. Misspellings. That is stupid. You know, things like that are going to turn off admissions committee members. If you don't care enough to make sure that everything you hand in is spick and span, and if you're going to be that kind of physician, we don't want you. Volunteer work. You're going to have some volunteer work so that typical student who wants to go to med school because they watched ER last night or something like that, and I get a lot of that, the typical 18 or 19-year-old, they want to see some volunteer work so that you know up close and personal that you've seen some of this stuff. Yes, this is what I want to do. Try to get a volunteer work, not shuffling papers on a desk. Try to get something where you can see some patient contact. Okay? Ask. Tell them what you want to do. Say, I need some interaction. Can I work in the ER room? Can I read? Some of our students go down to children and read to the kids down there. You know, that's one-on-one. You're seeing a lot of the problems that these kids have. What are some of the extras? We're not going to pad your application, but you want to put some things in there that are going to separate you from the other 300 and some applicants, okay? These things on the bottom here won't get you in by itself, but let's say there's 20 spots left. You're the last 20 out of the 160, and there's 40 people there. What are they going to do? They're going to look at, you know, the MCATs are pretty similar, GPA is pretty similar. What are they going to bring to the table? If you spoke Spanish, you would influence me. I had a young lady in my micro class 2 or 3 semesters ago. She had a full-time job at Children's, translating. That's how important it is. How would you feel if you were able to do that? As a physician, you were able to communicate in Spanish to some of your patients. You didn't have to call the translator. or even something like sign language. This is going to bring a little extra to the table. Biochemistry, is that required? No. If any of you sat down and met with me, one of the things I emphasize is biochemistry. Your competitors are going to have it. Biochemistry typically is a senior level course, and it's a tough course. If you have biochemistry and somebody else doesn't, boy, I'm going to be looking at you. It's going to make your life easier. Biochemistry is a course you're going to have to take when you get in there. Why not get your brains beat out here? And then when you take it over there, it's going to be a heck of a lot easier. If you take it here and then have to take it in med school, I guarantee you, you'll be able to see the difference in the kids that never had biochemistry and those that have had it as an undergraduate. Some people say, I'm going to shy away from all these tough courses because I want to keep my GPA high. If you're taking rinky-dink courses and only taking 6 or 9 hours at a time, an admission committee looks at these things. Your first semester of med school, you're going to be taking about 19 or 20 hours. You can't say, oh, I'm working full-time, I only need to take 2 courses. You won't be working, you're going to be taking a full load. And you better get used to taking a full load of tough classes. And there's probably a number of things we could put down there under extras that would qualify.